Welcome to my educative channel. I'm Dr. Ricardo Hoogstra, plastic surgeon, Buenos Aires, Argentina. I developed a new technique for facial rejuvenation, endoscopic brow lift, and upper and lower blepharoplasty. From here to here, I never resect the skin, I rejuvenate the skin with laser. Today I'm going to talk about lower blepharoplasty and cheekbone. There is a real importance between the lower eyelid and the cheekbone. Generally, in the aesthetic, the cheekbone has a good projection, and the lower eyelid, the distance of the lower eyelid is very short. Here we can see almost there is no stop between the cheekbone and the lower eyelid. Here we can see a lower eyelid, small distance between the tarsus and the cheekbone, good projection of the cheekbone. And also we can see in all beautiful women the good projection of the cheekbone and the lower distance of the lower eyelid. These are patients that I operate, and this patient I rejuvenate the upper and lower eyelid as I show in different videos. Today I'm going to talk about the importance of cheekbone. For this patient I inject hyaluronic acid to improve the projection of the cheekbone. This is the union between the lower eyelid and the cheekbone. You can see a long distance here, and here is a vertical oval, here is an horizontal oval, and you can see the projection and how the lower eyelid is shortening for the projection that I perform with hyaluronic acid. Here you can see a longer lower eyelid. This is the tarsus, and this is the union between or intersection between the lower eyelid and the cheekbone. And here is the projection and how the lower eyelid is shortening. And this is youngness, beautifulness, and this is the opposite. The same. And also in young patients, the projection of the cheekbone is very important. You can see the same, the oval in young patients. This patient come to my office to operate the lower eyelid. You can see the distance and the intersection between the lower eyelid and cheekbone. Lower eyelid skin is very long. There is no projection of the cheekbone. This is my technique without skin resection. I remove the upper and lower eyelid fat pad without visible scars. And here is the post-op. This is very good, no scar, tightening the skin with a carbon dioxide laser, but here is not good. No projection of the cheekbone and a long distance between the tarsus and the cheek. This is the intersection between the skin of the lower eyelid and the cheek. If I perform voluminization of the cheekbone, this result will be much better. You can see how my technique remove the lower eyelids, tightening the skin, no scar, no projection, the lower. This patient can perform in any moment injection of the hyaluronic acid in this area. This is not painful, just 1 minute procedure of 1 minute. Today I show this patient to talk about again about the relationship that have the lower eyelid with the cheekbone and the importance of give projection of the cheekbone. I hope you enjoyed this presentation. I'm professor of the university, and I'm trying to explain this in a way that all patients can understand and have a decision in a future blepharoplasty.